What does this patient value in their life that they've had to give up?
Mm-hmm.
We asked, what have you not been able to do that now because of pain that you used to be able to do, and how important is that?
Some of it too is if you're relatively new to chronic pain, right? Versus someone you see patients who have been dealing with chronic pain maybe for decades.
Exactly.
How's that different?
Well, the biggest thing is their expectations. I always, in every assessment, say at the end of the thing, at the beginning of their treatment, okay, let me explain to you that I'm not going to promise we're going to get rid of your pain completely. And the ones who've had pain for long, well, I know that. I've lived with pain. I just want to live better with it. Whereas somebody who's a brand new pain patient, because of surgery or a traumatic injury, they'll say, well, I just want it fixed. Can you not just fix this? And we're always very careful to say, I'm not going to promise you that we can fix this. That's not what we're about. We're about helping you manage your pain on a day-to-day basis.
And what happens in a situation where medically speaking, we've done as best as we can to quote unquote fix the problem, whether it's through procedures or medicines or whatever it may be, but they still have a component of pain.
Right.
Is there an issue of psychological acceptance?
Yeah, there is. I always look at psychotherapeutic readiness. Where are they in this pain journey? And I can tell you, and you guys don't do this, but the worst thing that they ever hear is, well, there's nothing more we can do. And you know this because you're involved here, that there's always other things we can look at, be it OT, occupational therapy, be it physical therapy, but also psychological growth is on a continuum. So this assessment that we always do looks at what are their expectations. I know you know that Dr. Jones does a lot on catastrophizing. What is the person saying about their pain to themselves? Like, okay, maybe I can't do such and such. I can't throw the basketball or the baseball outside with my son, but we could do Monopoly together. So looking always for other things, because that we can't do anything else. You got to live with the pain. That's not enough. We want to teach them how to live with the pain. So sometimes in that assessment, I'm a little bit of a cheerleader.
To kind of boost them along, give them some encouragement.
And to set the stage for, okay, you may be a chemical coper, and there may be other ways, not just medicine.
What do you mean by chemical coper?
When you and I have talked about this in the past, there are some folks, they get stressed, their pain goes up, they take a pill. Alcoholics, it's a disease as well. We can't go into that. We don't have time. But somebody gets stressed, I got to have a drink. And there's a lot of things. There's meditation, there's mindfulness, there's looking at sleep patterns, there's looking at activity patterns, expectations, thought processes. There's mindfulness. We've been doing a lot of that.
Mindfulness, meditation is
right.
Mindfulness practices.
It takes you out of your body experience to a degree, and so that your pain sensitivity will be decreased. I mean, that's well researched and evidence based, as you know.